and welcome to our channel Mid Study. Today in this video we are going to see about neonatal reflexes, which is one of the very important point in neonatal examination in pediatrics. So without wasting time, let's get started. Introduction. A number of primitive neonatal reflexes can be elicited in a term neonate. These disappear as the child grows. Absence of reflexes indicates general depression of central or peripheral motor functions, while abnormal persistence of reflexes is pathognomic of central motor lesions. First is sucking and rooting reflex. Sucking reflex is elicited by introducing a finger or teeth into the mouth, on which the vigorous sucking will occur. In rooting reflex, when the baby's cheeks come in contact with the mother's breast, he or she seeks the nipple and finds it without being directed to it. These reflexes are strong and well synchronized with swallowing at about 34 weeks. Rooting reflex is not prominent beyond 1 month. This image shows sucking reflex and this image is showing rooting reflex. Now Moro's reflex. Hold the baby at angle of about 45 degrees from the couch, then suddenly let the head fall back a short way. Reflex consists of abduction and extension of arms, hands open but fingers remain curved. This is followed by adduction and flexion. This reflex is accompanied with crying, extension of the trunk and head without movement of legs. It is usually incomplete in babies less than 35 weeks. It usually disappears by third month but can persist for about 6 months. Asymmetrical Moro's reflex is indicative of root plexus injury. These diagrams shows Moro's reflex being performed. Now grasp reflex. When baby's palm is stroked with examiner's index fingers, baby's fingers close on it and grasp it. Stroking on the dorsum of hand makes baby open the hand. It is present at birth and disappears by the age of 12 weeks. Persistence beyond this age must raise a suspicion of brain damage. This image shows grasp reflex. Now asymmetric tonic neck reflex. In supine position, when baby's head is turned suddenly to one side, the arm and leg on the same side are extended while on opposite limbs go in flexion. This reflex disappears by 5 months of age. Persistence beyond 6 to 9 months or a constant tonic neck posture is abnormal and usually indicates spastic cerebral palsy. This image shows asymmetric tonic neck reflex. Now walking or stepping reflex. Hold the baby in standing position and place the foot on a flat surface. Legs extend to take infant's weight. The opposite leg flexes and then extends as it takes the weight. The original leg flexes. Appears by 4 days of birth. Disappears by about 2 months. This image shows walking or stepping reflex. Now placing reflex. With the baby held upright between the hands of examiner and dorsal part of foot is brought lightly in contact with the edge of table, the baby flexes the knee and hip and places foot on the table. This appears by about 4 days of birth and disappears by 5 to 9 months. This image shows placing reflex being performed. So that was all about neonatal reflexes. I hope you liked the videos. Please like, share and subscribe to our channel and stay tuned for more such interesting updates. Thank you.